rotator physiotherapist at Foothills Medical Center, which means basically I change teams every 6 months. There's a rotation of 7 different teams that we go through, so it takes 3.5 years to do a full rotation, and it includes teams from a variety of practices throughout the hospital. So as a new physio, I knew that I wanted to work in a hospital, but I didn't know what area I wanted to be in. And being a rotator really gives me the opportunity to really try my hand at almost all the practice areas here at Foothills, which is quite a bit. And it also allowed me to kind of build my foundations in lots of different areas. Our patients are almost never just one-dimensional. They often have multiple health issues going on, or multiple reasons that brought them to the hospital. So having that foundation in kind of my physio toolbox was really intriguing to me. I really like the team aspect of it. We work really closely together as physios, and then also within our allied health department, so with our OTs and TAs, psychologists here in the burns team as well, and then also in the multidisciplinary teams working with the medical teams as well. So it's very much, I like that team dynamic for sure, and then the varied practice that's available, especially in a large urban center like Foothills. I am really enjoying the burns team right now. It incorporates a lot of different aspects of practice with both outpatient, inpatient, lots of team dynamics, lots of working with the team. I also really enjoyed my time on the cardiovascular and thoracic team. And I enjoyed my time in ICU. So as you can see, I'm still very undecided. So rotator is right where I'm meant to be right now. Yeah. When I first started school, I was kind of on the fence. I was pretty sure I was going to end up in acute care, but I also was interested in seeing how private practice went. I had a few placements. My very first placement was in acute care, and it was harder than I expected. So that kind of made me think maybe it's not the spot for me. And then I had some placements in private practice, and I had one particularly very good placement in private practice, and I thought I like this, but even with the best placement, a really quality placement, I still was I'm not sure it's the place for me. And then my last placement here at Foothills really solidified my decision for me.
The work-life balance in the hospital is great. It is an 8 to 4. You are afforded sick days, you are afforded vacation. You do get stats off, right? Anytime you take off, it's not a financial hit if you have to go to a funeral, right? So that work-life balance is huge. But the impact of the work is the bigger thing. Yeah, the culture is great. As a new grad, it's to be frank for all the students, no matter where you work, it's going to be very overwhelming your first year, but especially the first few months. But the learning opportunities, the mentorship, there's heaps available. You always feel like you have someone you can go to. Here at the PLC, our staff is, relatively young, I'd say. There are a lot of my classmates in it, so it is fun.
I think it's a very good decision to work in a hospital coming out of school, because it's a very supportive environment. So you are working not only with the whole rehab team and have team leaders, professional practice leads, but you have a lot of other physios and occupational therapists and therapy assistants that are all working together. So it's a very supportive team. In our hospital, there's so many different units and environments that you could work on. So anything from general surgery to medicine to stroke, geriatrics, ICU, ortho. You kind of get to see everything and have the opportunity to rotate and use skills from a variety of different patients, and kind of hone those skills that you may have touched on in school, but you get to dive deeper into that.
I did do a 6-week placement here, and that's where it was in one of my senior placements. It really consolidated that I wanted to come into the ICU when I finished. So for me, I chose to work in public practice because I wanted the collaboration and just that constant learning environment, just being surrounded by other professionals, other disciplines. I really wanted that engagement and learning as I went through my career. I also chose the Alex because it is a rotationary position, so you're able to see different areas, kind of find places that you love and areas of focus. One of the other reasons why I chose public practice is for income stability. Just knowing exactly how much you're going to make and having that stability is really important, as well as all the benefits that come with public practice. So for me, having paid sick time, paid vacation, like personal days, and health and dental, as well as a pension was really important for me. So